Many people seeking treatment for drug and alcohol use report concern about methamphetamine use. For some people, methamphetamine use is their main concern. Others use methamphetamine but are more concerned about their use of a different drug, such as alcohol, cannabis, or heroin. We wanted to know more about methamphetamine use among people seeking treatment, regardless of whether they wanted help with methamphetamine use or a different drug. Our project sought to describe what people who use this drug have in common, including identifying how frequently they use methamphetamine, the level and types of other substance use, their quality of life, and whether they're having problems like being arrested or experiencing violence. This was so that we can better understand the patterns and relationships at play between these issues. We also wanted to gather this information to provide better, more informed or more holistic healthcare. To do this, we did a statistical analysis on 10,000 de-identified electronic medical records across 6 local health districts in New South Wales. We found that 1 in 12 people, or 8%, who were seeking treatment for any drug, including alcohol, reported using methamphetamine on at least 12 days in the past 4 weeks, which is equivalent to around 3 days or more each week. People who reported using methamphetamine on 12 or more days in the last 4 weeks were also more likely to have been arrested in this time than people who either hadn't used methamphetamine or who had used it less often. They'd also used cannabis on more days and used opioids like heroin on fewer days. They were more likely to say their quality of life was poor than people who either hadn't used methamphetamine or who had used it but less often. We also found that almost a quarter, or 24%, of all people starting drug treatment had used methamphetamine in the preceding 4 weeks, even if they were more concerned about their use of a different drug. Most of the people who had used methamphetamine were starting treatment for methamphetamine use or for use of an opioid such as heroin. We believe our study shows that it's important to ask people who are seeking alcohol and other drug treatment about aspects of their lives that may be affected by or occur alongside their substance use. It's important to ask about all drugs, as it's common for people to use more than just the one they're seeking treatment for. And if we do this, we can do a better job of tailoring treatment to the needs and wishes of each person, instead of being too focused on just their main drug of concern.